Hello everyone. Today we will present to you some information about orthodontic diagnosis. Orthodontic diagnosis is a method and a procedure that is done to treat the patient, especially patients that need orthodontic appliance, and the cause of their malocclusion is most of the time a disharmony of the face. This disharmony can impede on the facial aesthetic or function. But still, we don't usually go for treatment right away because treatment has to be preceded by a correct diagnosis. The diagnosis of the etiology of the disease is more important than the treatment. So you have to keep that in mind before starting the treatment. We have to know the underlying cause of the disease or malocclusion. The patient that we treat, even for our matrix band appliance, we usually give antibiotics because some patients, like patients with cardiovascular diseases or heart congenital diseases, also patients that have a problem with some kind of disease. It is called atherosclerosis. It is called, one second. It is called rheumatic fever. Rheumatic fever is a disease that affects the patient, causing his heart to have abnormalities and not very resistant to bacteria. Also, patients having a murmur of the heart, problem with beating, and those kind of patients, we give anesthesia prior to tooth extraction or even applying a matrix band on the primary or deciduous molars. Some type of patients could have problem also. Patients that are having asthma also are required to be given these type of. We don't give antibiotics like patients with heart disease. Patients with asthma, we have to be careful that those patients could be negatively affected with orthodontic treatment because the orthodontic treatment could cause resorption of the root, an increasing chance of root resorption with asthmatic patients. Okay, so we talked about treatment and etiology. We talked about antibiotics now, and we talked about asthmatic patients and their increased chance of root resorption. Now we will talk about some contraindications of orthodontic procedure. some patients have or take cortisol, and those patients are not indicated for an orthodontic treatment unless they stop taking cortisol. And there is another drug that is contraindicated for orthodontic treatment, like tetracycline, and there are other drugs. One second. One second. And the other drug, other than cortisone, that the child must not take is called dilantine. The dilantine, from its name, it causes dilation of the gingiva, making it hard to apply an orthodontic appliance. Now, with precaution, we have to take serious measures with patients suffering from HIV and HBV, because those patients could infect the clinician that treats them of the disease. When it comes to allergy, there are patients that are allergic to many different materials that the dentist uses. And one of these material is called the plastic it's called latex. The latex is a type of rubber that is used in gloves, and also some patients are allergic to nickel and latex. So we have to take allergies in consideration when treating such patients. Metabolic diseases such as diabetes must be treated, and the patient must control their diabetes before we treat them with orthodontic procedure. Other types of diseases like hemophilia, extraction of teeth must be avoided. Trauma is a factor or a contraindication for orthodontic treatment, because while the dentist is performing his regular procedure, a necrotic pulp will be the result of the orthodontic movement. Therefore, avoid teeth that were subjected to previous trauma. The patient susceptibility it is happening when his parents are having bad oral hygiene. Therefore, we should examine the parents and their factors, heredity factors, especially class 2 division 1 and class 3 malocclusion, and oral hygiene are a good indication for the child oral hygiene and inherited abnormalities. Sometimes the mother of the patient is not taking sufficient folic acid. Therefore, many abnormalities could occur to the child. And not only folic acid, also she could be affected by viruses that could cause the palate of the patient to be abnormal. These viruses are called, some viruses cause the cleft lip. Then we should discuss the thalidomide. What is the thalidomide? 1 second, I will search it. Okay, so thalidomide and tetracycline are both drugs that can affect the child, causing very serious problems with the tooth. Therefore, the mother should not take tetracycline, neither thalidomide. And even excessive amount of fluoride is contraindicated for the pregnant woman. Some patients during the birth are subjected to forceps. These forceps helps the extraction or the birth procedure to be performed, but studies has shown that these forceps could cause TMJ problems and TMJ ankylosis, jaw problem also is caused by misuse of forceps during the giving the birth to the patient, to the child. Now we have the DLAN time. What is the DLAN time? I just mentioned, I think before, the DLAN time with cortisone are contraindicated. But I should make sure just to search DLAN time. So it looks like that DLAN time is an anti-epileptic drug, also anticonvulsant. It works by slowing down impulses in the brain that cause seizure. And I mentioned before that dilantine is not indicated when an orthodontic procedure is done, and cortisone is also contraindicated because dilantine causes gingival enlargement. But this one is not dilantine, this one is adenoids. So what is the meaning of adenoids? This one, adenoid, this one, the adenoid is the adenoid is a type of or some kind of resistance to bacteria and inflammation. It is nearby the tonsils, and when it is hyperatrophied, there must be some kind of a disease. I will research more and come back to you. Hyperplasia of tonsils and adenoid. Those cause mouth breathing. When someone has his dilantine, adenoids and tonsils hyperplasia, with a hyperplasia, then they usually do the mouth breathing. So dilantine is different than adenoids. But I will search more and see what is the meaning of dilantine, adenoid, cortisone. Okay, so dilantine, as I said before, it causes gingival overgrowth, and therefore the patient cannot be treated with orthodontic in this case. Thank you for listening to this lecture, and goodbye.